Today, I want to speak about a condition that is often detected far too late, not because people don't care about their health, but because the early clues are quiet, subtle, and easy to overlook. Pancreatic cancer is one of the most serious illnesses we face in senior health, and understanding its silent symptoms can make the difference between early intervention and delayed diagnosis. My purpose is not to create fear, but to empower you with awareness, clarity, and control over your own well-being. Below are the 6 key notes every senior and every family should remember. Unexplained weight loss that happens quietly is often one of the earliest and most easily overlooked signs of pancreatic cancer, especially among seniors who tend to associate gradual weight changes with age, reduced appetite, or minor digestive issues. But when the body starts losing weight without any effort, it is rarely a coincidence. The pancreas plays a vital role in digestion by producing enzymes that break down fats, proteins, and carbohydrates. When it is compromised even slightly, the body cannot absorb nutrients the way it should, leading to slow but steady weight loss that may feel unnoticeable at first. Clothes may start feeling a little loose around the waist, the face may appear slightly thinner, or meals that once felt satisfying may suddenly seem filling after just a few bites. These subtle shifts often come months before more serious symptoms appear. Many seniors dismiss this sign as a normal part of aging, but true age-related weight loss does not typically occur rapidly or without reason. The danger lies in its quiet nature. There may be no pain, no discomfort, and no dramatic change, yet the body is signaling that something is interfering with its ability to properly fuel itself. Some individuals may even feel that the weight loss is positive, especially if they have struggled with extra weight in the past, but unintended weight reduction almost always indicates that the body is under stress. It can also be accompanied by a loss of muscle mass, reduced strength, or a general feeling of weakness after daily activities that once felt manageable. Another important detail is that this type of weight loss can happen even when eating habits remain the same. The issue is not the food intake, but the body's inability to process and utilize the nutrients. Seniors may find themselves eating normally, but feeling as though the energy from those meals simply disappears. Family members may notice the changes before the individual does. That is why this quiet symptom deserves attention and immediate evaluation. When weight loss happens without explanation, it is not something to ignore. It is the body whispering that something deeper may be unfolding internally. Persistent back or abdominal pain is one of the most common early signs of pancreatic cancer, yet it is also one of the easiest to misinterpret. Many seniors experience back discomfort due to age-related changes like arthritis, poor posture, or muscle strain. So when pain appears gradually, it is often dismissed as something harmless or familiar. But pancreatic pain has a distinct behavior that deserves close attention. It usually starts in the upper abdomen near the stomach area and slowly radiates toward the back, forming a deep, dull ache that seems to settle beneath the ribs. Unlike typical muscle pain, this discomfort does not improve with rest, stretching, or changing positions. In fact, it may worsen when lying down and feel slightly better when leaning forward, a small detail many people overlook. What makes this symptom dangerous is its persistence. It doesn't come and go like common abdominal cramps, nor does it flare up only during physical activity. Instead, it lingers throughout the day, sometimes mild, sometimes more intense, but rarely disappearing completely. Some seniors describe it as a pressure or heaviness rather than sharp pain, which makes it easy to ignore. Over time, this discomfort can begin to interfere with sleep, reduce appetite, or cause a general feeling of uneasiness after meals. Because the pancreas is located deep within the abdomen and close to the spine, inflammation or growth within the organ often affects nearby nerves, leading to this radiating pattern of pains. Another reason this symptom goes unnoticed is that it can mimic other conditions like gallbladder issues, acid reflux, or chronic indigestion. Seniors may treat it with over-the-counter medication, warm compresses, or pain balms, experiencing only temporary relief. But true pancreatic-related pain continues to return. Regardless of home remedies, listening to this pattern is extremely important. The body is signaling that something internally is not functioning as it should. Even if the pain feels manageable, its consistency is the red flag. When abdominal or back pain develops without a clear cause, lasts for weeks, or gradually intensifies, it should never be ignored. It is the body's way of calling attention to a deeper issue that requires proper medical evaluation before it becomes more serious. Sudden onset of jaundice is a critical and often alarming sign that should never be ignored, particularly among seniors. Jaundice occurs when there is a buildup of bilirubin in the body, a substance normally processed by the liver and excreted through bile. In cases of pancreatic cancer, the tumor may press against or block the bile duct, preventing normal flow and causing bilirubin to accumulate in the bloodstream. The first noticeable signs are often a yellowing of the skin or the whites of the eyes, which may initially appear subtle but gradually become more pronounced. Even a slight change in color, when unexpected, is a signal that something serious may be occurring internally. This symptom often develops quietly without the discomfort of pain or other obvious illness, which is why it can catch individuals off guard. Jaundice is frequently accompanied by darker urine and lighter colored stools. Patients may also experience intense itching, known medically as pruritus, which occurs due to the accumulation of bile salts beneath the skin. Many seniors may dismiss these changes as minor or related to diet, dehydration, or age-related skin issues. But in reality, these are early warning signs of pancreatic distress. Because the pancreas sits near the liver and bile duct, even a small obstruction can produce significant biochemical changes in the body. Left unrecognized, this symptom often coincides with other complications, including unexplained weight loss, fatigue, and digestive disturbances, which may appear over time and mask the underlying cause. The suddenness of jaundice is especially important. Unlike gradual yellowing due to chronic liver conditions, the appearance of jaundice over a short period should prompt immediate medical evaluation. Family members often notice the color change first, even before the individual realizes it. Seniors themselves may experience confusion or worry when they notice it, but hesitation to seek medical advice is common. It is crucial to understand that jaundice is not a cosmetic issue. It is the body signaling that an essential pathway for processing waste and toxins is blocked. Ignoring it allows potential complications to progress, making diagnosis and treatment more difficult. Early recognition and prompt attention can significantly improve outcomes, and no matter how subtle it seems, any sudden change in skin or eye color requires immediate assessment by a healthcare professional to determine the cause and initiate timely intervention. Digestive changes that seem minor but persist are often one of the quietest early signs of pancreatic cancer, yet they carry crucial information about what is happening inside the body. Seniors may notice subtle shifts in how their stomach feels after meals, such as bloating, excessive gas, or a sense of fullness that arrives unusually quickly. They may experience discomfort that feels like indigestion or heartburn, and occasionally notice pale, greasy, or floating stools that do not resemble their normal bowel movements. Because these changes are gradual and mild at first, many dismiss them as the result of diet, aging, or temporary gastrointestinal upset, but in reality, they reflect an important disturbance in the pancreas's ability to produce the enzymes necessary for proper digestion. Over time, the inability to digest fats and nutrients effectively can contribute to weight loss, nutrient deficiencies, and overall weakness, making these small signs part of a larger pattern that should never be ignored. Another important aspect is that these digestive changes often appear without other obvious symptoms. Meals that once felt satisfying may suddenly leave a person feeling uncomfortable or bloated, and common remedies like antacids or minor dietary adjustments provide only temporary relief. Seniors may also notice changes in appetite or a subtle reluctance to eat foods that previously caused no problem, which can contribute to a slow decline in energy levels. Family members may observe that someone is eating less or feeling tired after meals, even if the individual does not actively complain. Because the pancreas is responsible for secreting enzymes that help break down proteins, carbohydrates, and fats, any disruption in its function can manifest quietly in the digestive system long before other symptoms, such as pain or jaundice, appear. These persistent changes should be interpreted as the body signaling that something is not functioning correctly internally. While they may seem minor, ignoring them can allow the underlying problem to progress unnoticed. Early attention to digestive shifts, combined with medical evaluation, can reveal pancreatic issues sooner and increase the chances of successful intervention. Even if the discomfort appears small, Repeated or ongoing digestive disturbances are an important red flag that requires professional assessment before the condition worsens and more serious complications develop. Sudden diabetes or rapid changes in blood sugar can be one of the most surprising and easily overlooked early signs of pancreatic cancer, particularly among seniors who may already be monitoring their health closely. The pancreas is responsible for producing insulin, the hormone that regulates blood sugar levels. When the pancreas is affected by a tumor, its ability to produce insulin can be disrupted, leading to unexpected fluctuations in blood sugar. In some cases, an individual may develop diabetes for the first time later in life, even if they have no family history or previous risk factors. This abrupt onset should never be ignored, as it may be the body's way of signaling that the pancreas is under stress. Symptoms may appear gradually, including increased thirst, frequent urination, unexplained fatigue, and sudden hunger changes. Yet seniors often attribute these signs to age, lifestyle, or minor health issues rather than considering a deeper problem. Rapid changes in blood sugar may also be seen in individuals who already have diabetes. Sudden difficulty managing glucose levels, episodes of hyperglycemia, or unusual fluctuations, despite following routine medication and diet plans, can indicate an underlying pancreatic issue. The body's internal systems are finely balanced, and a disruption in insulin production can have ripple effects, affecting energy, mood, and overall metabolic health. These changes are subtle enough that they might be dismissed during regular checkups, especially if blood sugar readings occasionally appear normal, but consistency and pattern are key indicators. Family members or caregivers may notice fatigue, unexplained weight loss, or mood changes accompanying these fluctuations, and these observations are important clues that should prompt further medical evaluation. It is essential to understand that new onset diabetes or rapidly changing glucose levels are not always ordinary age-related conditions. When these changes appear suddenly, particularly in individuals over 50, they should be investigated carefully rather than assumed to be lifestyle related. Early recognition of abnormal blood sugar trends can lead to timely testing for pancreatic function, which can reveal potential issues before more serious symptoms appear. Ignoring these warning signs allows the condition to progress quietly, reducing treatment options and increasing risk, and even subtle, persistent changes in blood sugar levels should be taken seriously as the body communicates that something deeper may be occurring. Internally, constant fatigue with no clear cause is one of the most subtle yet significant signs that the body may be struggling with pancreatic issues, and it is often overlooked among seniors because low energy is commonly attributed to age, stress, or minor health problems. Unlike ordinary tiredness that improves with rest or sleep, the fatigue associated with pancreatic cancer is persistent and disproportionate to daily activity. Individuals may find that routine tasks such as walking short distances, completing household chores, or even standing for extended periods feel unusually exhausting. This kind of fatigue does not resolve easily and can gradually interfere with independence, mobility, and overall quality of life. It is often accompanied by a sense of heaviness or weakness in the muscles, making simple movements feel more strenuous than they once were. The cause of this fatigue is rooted in the body's internal struggle. As the pancreas becomes compromised, its ability to aid in digestion, regulate blood sugar, and maintain energy balance diminishes. This inefficiency can lead to nutrient deficiencies, low blood sugar, and metabolic stress, all of which contribute to an ongoing sense of tiredness. Seniors may notice that they feel drained even after sleeping for a full night, or that they require multiple breaks during activities that previously posed no challenge. Family members may also observe that the individual seems less engaged, slower in movement, or more easily fatigued than usual, which can serve as an important clue that something deeper is occurring internally. Fatigue may also appear alongside other subtle signs, such as mild digestive changes, weight loss, or unexplained discomfort, creating a pattern that often goes unnoticed until more serious symptoms emerge. Many seniors normalize this exhaustion, assuming it is simply part of aging, but persistent fatigue is a warning signal that should not be ignored. Listening to the body's energy levels and monitoring changes over time is crucial, because early recognition can prompt timely medical evaluation. Ignoring ongoing fatigue allows potential pancreatic issues to progress silently, delaying diagnosis and reducing the effectiveness of treatment. Persistent, unexplained tiredness is the body's way of communicating that internal systems are under strain, and paying attention to these signals can make the difference in identifying problems before they become more serious. Pancreatic cancer is often called a silent disease for a reason, and recognizing its early warning signs can make a life-changing difference. From unexplained weight loss and persistent back or abdominal pain to sudden jaundice, subtle digestive changes, rapid blood sugar fluctuations, and constant fatigue, each of these symptoms is your body trying to communicate that something is not right. Seniors, in particular, must pay close attention to these signals because early detection offers the best chance for effective intervention. Awareness is your most powerful tool. Do not dismiss subtle changes as normal aging or minor discomfort. Take the time to observe your body, track changes, and seek medical evaluation if any of these warning signs appear. Early action can not only improve treatment outcomes, but also preserve your quality of life, energy, and independence. Remember, your body communicates in whispers before it shouts. Listening closely, acting promptly, and consulting healthcare professionals can help detect pancreatic issues before they escalate. Share this knowledge with loved ones because understanding these silent signals can protect not only yourself, but also those around you. The sooner these signs are recognized, the sooner proper care and treatment can begin, making a real difference in health and well-being. Your health is worth paying attention to every single day, and no symptom, however small, should be ignored. By staying informed, observing your body carefully, and acting quickly when necessary, you take control of your health rather than letting a silent disease control your life. Awareness, vigilance, and timely action are key. Let this knowledge guide you to prioritize your health, check for the signs, and encourage regular medical evaluations. Taking these steps today can make all the difference tomorrow. Your body is sending messages. Listen to them, honor them, and act on them because early recognition can truly save lives.